Hi, this is Lori Lenicky. I am giving a talk on week 5. We're actually going to podcast week 5, and you'll view this before week 4. I thought week 4 was much more interactive and it wasn't as conducive to a podcast. So, we're going to talk about effective teaching. What do we hope to do out of this lecture? Describe the four types of potential learners. We've talked about that already with Kolb's learning cycle. Describe the characteristics associated with 5 levels of audience expertise. Discuss how audience expertise levels impact teaching approaches. Discuss how effective needs assessment ensures that your presentations meet the needs of your learners. Compare different learning approaches to completing a needs assessment of your audience. Implement an effective needs assessment to your audience to guide your presentation. And develop appropriate learner-centered objectives in the 3 domains of learning. A few more objectives. Determine how to sequence a presentation to optimize engagement and learning in a presentation. Select active learning strategies that will engage your learners, reinforce learning, and enhance their retention in a presentation. And select active learning strategies that will engage your learners, reinforce learning, and enhance the retention of clinical education situations. So, why are we learning about how to be an effective teacher? There's going to be times in a clinical setting that you will be teaching patients exercises, activities. You will also be able to teach someone how to prevent problems, teach them about their medical condition. You're not just teaching them how to do things. At times, you will be teaching them um, more of the cognitive things. So, what is wrong with them? Often, patients come from physicians that physician didn't really tell them much, and they don't know a lot about their condition. Also, there's going to be times when you'll have to present in services or educate those around you that are also clinicians. All right, so back to Kolb's learning cycle. Many of you, based on your reflective journals, were assimilators. We did have a good bit of kind of around the whole circle, but the majority of you were assimilators. Um, that's probably going to be the way you teach, is you're going to teach the way that you like to learn. The reason I'm bringing Kolb's learning cycle back into this is make sure that you teach around the wheel. Be prepared for what we would call the scientist, the professor, the friend, and the inventor. So make sure that when you're teaching, you don't just stick to one learning cycle. The next thing you want to think about is your audience expertise. So imagine now that you are coaching soccer. Think about what you would do to coach soccer. Now, for those of you who thought about coaching 5-year-olds playing soccer, you probably thought of a different type of teaching style as opposed to someone who's teaching 12-year-olds or 17-year-olds in a highly competitive league or college students. Now think about teaching 40-year-olds who've never played soccer before but want to start. So, how you go about teaching will depend on the expertise of the audience. When someone is a novice, they are relying on you for information. They have no knowledge of the rules. They can become an advanced beginner where they start to get some experience with their skills. Um, Move into being competent where they can actually practice. They may not need direction all the time from you, but they do need feedback on how they can improve. Proficient, when they have the ability to see the big picture and to be able to make some of the changes on their own without as much feedback. To be an expert where they no longer rely on the specific rules. They are able to use their intuition to do their skill. Now, this is not just with soccer. I brought that up, and you're probably all thinking about soccer, but this can be with any kind of task that you're learning. Realize that the novice is more of a pedagogical approach, which is how we teach children, if you think back to the lecture from week 3, where the experts are those who already have the skill, we may need more of an andragogical approach to where you need to treat them as if they are an adult learner. Another way to look at adult expertise is in the early exposure, developing competence, or approaching mastery. Everyone who learns a skill will go through all of these areas. Sometimes you can go through all of this in one day if it's a simple task. Sometimes this takes a lifetime to get to mastery. So you can't always go by the age and the experience. Sometimes it depends on the task that's involved. These boxes are not mutually exclusive of each other. Sometimes they overlap. And sometimes you can go through and be mastery at a certain task and then learn a new one and come back to being someone who's in early exposure. If you don't know where your learner is on this curriculum, you may not be teaching them appropriately. And again, this has to do with motor skills and cognitive tasks. So if someone knows nothing about a topic, if you're teaching somebody about their rotator cuff injury, they know nothing about rotator cuffs, they're looking at you for every detail. To where if you're talking to a physician who knows a lot about a rotator cuff, you may be going into more details about rehab specific and more complex problems related to a rotator cuff. I used to give in services to other departments, often to nurses or house cleaning staff. And I would start each in service and say, I know y'all all hate sitting through in services, but I want to make this useful and I want to make sure you get something very useful from it. So if I'm saying something that you already know, it's okay to tell me to go on and to move on to something more difficult. But if I'm saying something that's over your head, let me know that too. I want your time to be useful. So letting them know this makes them realize, wow, she does care about what level of learning I'm at. And so make sure that you're teaching to that level. And to kind of go along with that last point, you need to know the expectations of the audience. What are they expecting to learn from your presentation? So you need to know what they're expecting to learn. You need to know how they'll know when learning occurred and how they'll be evaluated or assessed. Why is it important to them? And what qualifies you to teach this content? So making sure that the audience knows all of these answers will help them to have a better learning experience. So, how can you do this? You can do something called a needs assessment. So, determining what the needs are of the audience before you design your class. If you're going to a church and you're going to go talk to a church group about, let's say, proper posture, you may want to know, are you talking to the youth group at church? Are you talking to older adults? Is it going to be people from the ages of 10 all the way to the age of 95? And that may adjust how you're teaching. Um, you also want to know what they want to know. If maybe they've already been educated in proper posture and they want to know how to continue to further improve it as they're sitting or as they're doing difficult tasks. So understanding everything about the learning process will help you to teach better. Writing good objectives for a teaching session will help you focus what you want to teach. And understanding how to write good behavioral objectives is necessary. Defining objectives, you need to define and clarify the content. It helps to guide your teaching methods, helps to also guide your assessment. So, how do you know that the learners actually learned what they were supposed to? And you can determine how effective you were as an educator or as an instructor. All right, we're now going to talk about Bloom's taxonomy. So, Bloom designed, I'm going to go back a slide, I apologize. Bloom designed a taxonomy of classifying intellectual behavior and learning. There are three major domains within this taxonomy: the cognitive, psychomotor, and affective. We're going to go through all of those. But within each domain, there's different levels. And so we will talk about lower level learning and higher level learning. A lot of this is what we talk about in PT school. We want you to understand the basics, but you also have to have that higher level learning where you are able to integrate and apply what you learned. So again, the three domains are cognitive, psychomotor, and affective. Each domain is distinct, and when you're developing learning objectives, you need to know what you're trying to teach and how it fits within each of these domains. And again, each of these domains are further classified from simple to complex. The cognitive domain refers to any knowledge that you have. So it's something within your brain. And the taxonomy can go from something simple as remembering or retrieving previously learned material. This would be something that you've memorized. To comprehension, so understanding the construct or meaning from that material. Application is being able to use that material in new situations. You can go all the way through applying, which is carrying out a procedure through executing or implementing, and applying related and refers to situations where learned material is used through products like models, presentations, interviews, and simulations. So spitting back information that you memorized is the lowest level of Bloom's taxonomy. And we've talked about how you have to learn in PT school. Being able to just remember and retrieve information isn't going to be good enough. You have to be able to apply. Here is another taxonomy for the cognitive domain of Bloom's taxonomy. And it starts again with knowledge at the bottom, comprehension, application, analysis, synthesis, and evaluation. So moving up that taxonomy is a more difficult and higher level skill within that cognitive domain. Now, many of the verbs used here can be used when writing a goal or an objective for each domain. So if you want somebody to have low-level taxonomy, you may ask them to define something or repeat it. If you want to make sure that they can apply or in the application level, you can say use this information or make sure that they can apply it in any situation. Psychomotor domain. This requires physical movement. So being able to do a task, okay? It requires degree of movement or manipulation. This would be any of your manual skills. So as you get into your physical therapy coursework or many of the things you're doing now in test and measures, when we test you written in a multiple choice exam, we're testing your cognitive knowledge. But when we test you doing a practical, it's more the psychomotor domain. Can you actually physically do the task and do it correctly? So a progression for the psychomotor domain starts with perception, then set, a guided response, basic proficiency, complex overt response, adaptation, or origination. So creating something new would be the highest of the psychomotor domain. Here's another view of taxonomy. And again, you can use some of these verbs. So if you want somebody to just have the perception, can they distinguish between one or another? But if you move up the taxonomy to guided response, can they duplicate or imitate to where they get all the way to organization? Can they design a new psychomotor task? And the final domain is the affective domain. And this includes how we deal with things emotionally, such as our feelings, values, appreciation, enthusiasm, motivation, and attitude. A lot of what we talk about in physical therapy school is professionalism. And professionalism is definitely within the affective domain. It is a behavior. And with affective domains, all of these things are considered behaviors. This can be more difficult to define and more difficult to work on, but it is often one of the most important pieces and one of the big missing pieces we see in clinical practice. With the affective domain, you transition from simple to complex, but you also can transition from concrete to abstract. So concrete are those defined rules that everybody expects, to abstract, which can be more open for interpretation. External locus of control to internal locus of control. So do you tend to only focus on what the external world tells you to do, or are you able to internally control yourself? And conscious to unconscious internalization of values. So, do you have to think hard to behave appropriately, or does it become part of your normal everyday values? And within the affective domain, here are some uh, definitions throughout the taxonomy. So, receiving, so having an awareness or willingness to hear. Responding is active participation on the part of the learner. Valuing is the worth or value you attach to a particular occurrence. To organization and characterization. And here are some sample verbs from the affective domain, going from the lowest level taxonomy on the left to the highest level taxonomy on the right. And these can be utilized when setting behavioral objectives. Now we're going to talk about those behavioral objectives. So many people consider these goals, but anytime you're writing, you will write these in documentation next semester and from then on in patient care, writing goals for what you expect the patient to be able to do. When you're teaching in any setting, you also want to write behavioral objectives of what you want your learners to be able to do. And behavioral objectives should have an A, B, C, and D. So the A is audience, and that is who. B is the behavior, it's the what. Condition is the when and how, and degree of mastery, or how well or how much. So within any objective, there needs to be an audience, a behavior, a condition, and a degree. The audience should always be the learner. If you're talking about patient care, it should be the patient, but it should not include you. You are the one performing the teaching. Your goals are for what the student will learn. Let's take a look at this goal. The student will be able to recognize the proximal attachment of a superficial back muscle on a scapula within 1 minute during a practical examination. So the audience A is the student. So we are worried about what the student will be able to do. Behavior. And so this is a cognitive domain. So they are trying to, and it's low level, they can recognize, it's the remembering level, they can recognize the proximal attachment of the superficial back muscle on the scapula, the condition during a practical examination, and the degree is within 1 minute. You don't always have to go in order. You can start with, within 1 minute, the student will be able to recognize the proximal attachment of a superficial back muscle on a scapula during a practical examination. So the degree went first. In this original example, the degree was third and the condition was fourth. So they do not have to always go in A, B, C, D order, but you need to make sure that all content is covered. I want you to take a look at these 3 goals, and I want you to be able to identify the audience, behavior, condition, and degree. I also want you to tell me what domain. Is it in the cognitive, the psychomotor, or the affective domain? And we will talk about these in class when you come in next week. And here are 4 more goals to practice with. I want you to identify the domain and the audience, behavior, condition, and degree. Please make sure that you have these done when you get to class next week so that we can put them up on the board and move through them quickly. We will do this in your team-based learning groups. All right, back to presentations. Learners need time to process information, especially if they want to become an engaged learner. So you need to have a balance between content and time to process that. And so if your goal is integration and apply information, you need to decrease your content and increase the process time. But if your goal is more exposure to a topic and you just want to give them as much information and you're not worried about their ability to apply it, it is okay to have an increase in content and a decrease in processing time. Sometimes we're not looking for mastery when we're teaching students. We just, or not even students, but maybe it's patients or in an in-service. Sometimes we just want to expose someone to the information. So those are the times when it's okay to have a lot of content without a lot of processing time. How can you optimize learning when you're presenting? So one thing is to present the information in containers. So chunk the information. Make sure you have an activity every 20 to 30 minutes related to all the information that has been chunked together. Realize that covering the material does not always equal learning. Again, think back to undergraduate. How many times did you sit through a lecture and at the end you have no idea what was said? So just covering the material does not mean that the learner learned it. And curse of being an expert. Sometimes when you know the content very well, you have a hard time understanding that someone has no knowledge of that area. First time I ever taught in a PT program, I was working as an adjunct and I was teaching a course very similar to your test measures. First day, the instructor pulled out a goniometer and explained the parts of a goniometer to a student. I was so surprised that students didn't know what a goniometer was, but I thought back to my days in PT school that I didn't know what one was until I went to PT school. I was an expert at this point in taking goniometry measurements. I forgot what it was like to not know how to do that. So, the curse of being an expert, make sure you step back and start with the basics for those who don't have a full understanding of what you're talking about. And finally, motivational hooks and content boosters. Anything you do to capture the learner's attention can serve as a motivational hook. It helps to create an emotional connection to both the instructor and to the material that's being taught. You don't want to overwhelm them and you don't want to lose the underlying idea of why you're there. But making sure the motivational hook is relevant to the content and gets them interested is important. Sometimes it can be a small question. It doesn't have to be anything theatric or um, too over the top. Content boosters are also needed. So these are any materials or activities that you can do to reinforce learning and allow that time to process the information. Once you teach them something, they have to be able to process it and apply it. And so making sure you have these content boosters are important. Thinking back to motivational hooks, my very first day of college, I had chemistry. I was a chemistry major and walk into a chemistry class full of about 300 or 400 people in this huge auditorium. I'd never been in a classroom that big, and everybody's talking and figuring out where to sit and getting to know people around them. And all of a sudden, there's this big explosion up front, and everybody gets quiet. And the instructor turns and said, "That, my friends, is chemistry." And I'll never forget it. So it made me love chemistry. Now, you don't need to have explosions at the front for every class, but having something relevant to help the learners be interested in what they're learning is important. Thank you. If you have any questions, please email me. We are going to go over a lot of this next time we're in class and do some activities related to these tasks. Thanks.